Now we're going to review the femur, the largest bone in your body. It's a long bone. And again, we'll just look at a few views of it. We have on the left here the anterior view. So we have superior, inferior, lateral on the left-hand side, and medial. And you know it's the medial side because the femoral head, which forms the hip joint with the acetabulum, is on the medial side. We also have the posterior view, and we have again superior, inferior, medial on the left-hand side of the posterior view, and lateral is the right-hand side. So let's look at the features. And most of the features are going to be at the epiphysis, so at the top or the bottom of the bone, and we'll go through them. So we have our femoral head. As I said, it's on the medial side. It is one way to determine if it's a right or left femur. You have the anatomical neck, which is right below the femoral head. The fovea capitis is a little indentation on the femoral head that you'll note when you look at the bones in the lab. Greater trochanter, a huge muscle attachment site, and you can palpate it on the lateral side of your hip joint. So greater trochanter just means like a bump of bone, and it's greater, so you can probably guess that there will be a lesser trochanter. So here we have the greater trochanter on the lateral side, lesser trochanter on the medial side. These can be confusing and you will just have to memorize them. So the intertrochanteric line is a line formed between the two trochanters on the anterior side. So the line is anterior. The intertrochanteric crest is a line that connects the trochanters on the posterior side. We also, on the posterior side, have a few other tuberosities, and these are bumps on the bone because the muscles attach there. So the gluteal tuberosity, where your gluteal muscles attach, is on the posterior lateral side. The pectineal line, where the pectineus attaches, is posterior, but on the medial side. And then all the way down the posterior part of the bone is the linear aspera. It's very prominent. It is on the posterior side, and it's the attachment points for all your quadricep muscle group. All right, so let's look at the femur again. We have the anterior view and the posterior view. And we're going to look at the inferior structures. So we have the lateral epicondyle. So it will be on the lateral side, and epicondyle means above the condyles. So again, if you're looking at a bone, you can always look for this femoral head, and that's the medial side. So the condyle on the opposite side is the lateral epicondyle. You have the medial epicondyle, which is on the medial side. You have your lateral condyle, again on the lateral side. You can see it both anterior and posterior. You have your medial condyle, which is on the medial side. You have the adductor or the adductor tubercle, which is on the medial side. So it's a little bump where the adductor muscles attach. And then you have the intercondylar notch or intercondylar fossa. And between the two condyles, it's easiest to see it on the posterior side. So this is like the indentation between the two condyles.